Since being drafted first overall in the 2020 NFL Draft by the Cincinnati Bengals, Heisman Trophy winner Joe Burrow has had an exceptional rookie season. Recently, however, it appears that he has suffered a major left leg injury while playing Washington. The Cincinnati Bengals Twitter account has posted an injury update saying that Joe Burrow is declared out for the remainder of the game with a left knee injury. Although it's too early to know specifically what's going on with his left knee, we can make a few educated guesses based on the mechanism of injury. Welcome back, everybody. My name is Nick Gallo and I'm a doctor of physical therapy. Today I will be discussing the initial stages of the Joe Burrow left leg injury. If you like today's video, please hit that subscribe button and give it a thumbs up because I will be posting a follow-up video in the future regarding Joe Burrow's injury when we know more details. I will also be doing more videos in the future regarding other sports injuries, rehabilitation, and physical therapy related content. With today's video, I want to go over Joe Burrow's mechanism of injury specifically and go over a few injury scenarios that are possible at this point. So first, let's take a look at the injury itself.
Here we can see that the Bengals are in shotgun formation and Joe Burrow steps back to pass. As he throws, he gets hit in his left leg. Immediately after the hit, he's observed to lay on the ground and grab at that left knee area in pain. He's then approached by the Bengals medical staff who come onto the field and begin to look at that left knee area. You can see here they are doing some tests on that left knee and asking Joe Burrow if that increases his pain at all. When they have concluded their testing, Joe Burrow is observed to not put any weight through that left leg and is carted off the field. Let's take a look at the injury in slow motion. Here we see that Burrow is observed to plant his left leg as he goes to throw. As he follows through, all his weight is onto his left leg and two players fall into his left leg. The direction of force is going from outside the knee to inside the knee, which is known medically as a valgus force. With the impact, we see how Joe Burrow's left knee bends inward. Here's an illustration of a valgus force. If enough force is applied, the following structures could become injured. This includes the medial collateral ligament, or MCL for short, the anterior cruciate ligament, or ACL for short, and finally the meniscus. It's important to know that although the ligaments and meniscus are typically affected in this type of a force, that bones may also suffer injury to this type of trauma as well. In order to have a definitive diagnosis to know specifically what has been injured, Joe Burrow will be undergoing an MRI, which is used as the gold standard for these types of injuries. The best case scenario right now is that Joe Burrow has some sort of a ligament strain and that no structure in the knee is torn. If Burrow happens to have a tear to any one of these structures and or a fracture in one of the bones, then this is going to greatly impact his recovery time.
So to recap, Joe Burrow will most likely be sent for imaging immediately to rule out any leg fractures. I have a feeling they will be looking specifically at Joe Burrow's left tibia and fibula bones because his foot was planted in the turf. Also, the mechanism does seem to be similar to the Joe Theismann leg injury, however, it's not conclusive at this point whether or not they're actually broken. Next, of course, they're going to take a look at the integrity of the knee ligaments themselves. The gold standard for this, of course, is the MRI. Based on the direction of force that was placed on Joe Burrow's left knee, it looks like that the MCL is most likely involved and also potentially the ACL. However, the best way to know this is by having that MRI. An MRI is also very useful because it'll show us whether or not a meniscus has been torn in his left knee as well. The best case scenario for Joe Burrow at this point is that he has some sort of a ligament strain where no structures in the knee are torn at all. The worst case scenario, of course, is going to be whether or not he has one ligament or multiple ligaments torn in his left knee. The big ligament injury that we always hear about is the ACL, and if that in fact is torn, then he's going to be out for the remainder of the season. Hopefully he has no ligament tears at all and he's able to hit the field very soon. And as of right now, that's all we know about the Joe Burrow knee injury. As more details come out about the specific injury itself, I will be doing a follow-up video to help explain what else is going on with the injury. If you happen to see any updates or anything, please post them in the comment section below. Thank you for watching, and I'll see you next time.